Hello, welcome to my YouTube channel. I'm Dr. Hassan. So today we are going to discuss two important topics for Plab 2 exams. So you have to do it at least once before coming to UK for your Plab exams. So a lot of doctors are misguided that they are saying that once you come to the UK, then you start for these topics. Rather than, I must say that you should do it before coming to UK because one third of your Plab 2 exams are from these topics, and you can easily get maximum marks in these topics if you have fully grip on these topics. So I would advise you to do at least once before coming to UK, so you can get maximum marks in your Plab 2 exams. So we will discuss these topics today. So let's start. So these are called practical stations. These are Simman prescription, examination procedures, and teaching stations. Okay. So let's start with Simman. So there are around 13, 14 stations of Simman up till now. These are like asthma, anaphylaxis, COPD, heart failure, acute limb ischemia, sepsis, hypoglycemia, PPH, postpartum hemorrhage, pain post cesarean section, arterial fibrillation, morphine overdose, and hematemesis. Okay, so what you have to do is that you will have to a journal approach for Simmen. Then you will have to remember the management part of different uh, stations. For example, asthma, you do need like giving oxygen, and after that you will have to nebulize with salbutamol and repeat salbutamol and ipratropium bromide. So So, and in anaphylaxis, what you have to do is that you will have to diagnose it, and then after that, you will have to start management. For example, giving adrenaline and oxygen. If there's blood transfusion or any medication transfusion, you will have to stop. So, what we have to do in Simon is that you would have to make a journal approach, A to E approach, and then after making this approach journal, then you will have to memorize different management for different um, stations like heart failure, acute ischemia, and other stations. So we will discuss detailed Simmen in another video, and it might be helpful for you. So we will discuss each and every Simmen in next upcoming videos. And the second is prescription. So there are almost 35 to 40 recalls of prescriptions. So you will have to memorize each and every prescription. There are few topics that can become in prescription. Might be it could be drug interaction, palliative treatment, antibiotic or fluid or pediatric. Okay, so what you have to do is that you will have to you should know how to write the prescription letter. You can print out it. You can get it on different platforms. So before coming to the UK, you can print out it and then you can practice on the paper. So I would advise that uh, AZT prescription is very good in terms of management and everything. You can follow AZT, and you can also subscribe AZT, Dr. AZT, for prescription, which is cost like £10. So you can get like maximum marks in prescription. So we will also discuss prescription. You can find how to write prescription in my videos. So we will have another video on prescription in detail in upcoming days. So the third is examination station. In examination station, there's antenatal examination, abdominal examination, testicular examination, eye and ear examination, breast examination, speculum examination, and prostate examination, and joint examination, which include shoulder joint, knee joint, and ankle joint. Sorry. So in examination, what you will have to do is that you will have to initially take history for 2 minutes, then you will have to go for examination, and after that you will discuss few management points with the patient like in 2 or 2 minutes. So what you have to do is that in examination, the golden rule is that you will have to minimize your history. You can just ask the important uh, questions in history within 2 minutes, then go for examination. So in examination, there are specific things you have to keep in mind. For example, patient privacy is most important thing. So you will offer chaperone, and apart from this, the patient consent is most important. So you will have to ask before starting the examination. So all these things you will have to keep in mind. Then in examination station, if you don't complete history, examination, and management, you cannot pass this station easily. So main important thing in examination is you will have to do history, examination, and management. What actually doctors, most of the doctors doing that they will take long history, and at the end they could not find time for examination and management part in these stations. So you will have to practice these stations. So you can find YouTube videos, and then you can practice it with pillows or something else back at your home country. Or you can also have a partner, study partner. You can also practice with your study partner in your home country. So we will also make some videos on examination in upcoming days. So stay tuned with us. The fourth one is procedures. These are cannula, blood culture, ABGs, blood sampling, Foley's catheterization, cervical smear. This is also important. They what actually they look for. How do you follow the aseptic measurements during these procedures? So these procedures are also important, and if you follow and if you practice these procedures, you can get like 12 out of 12 in your exams. So don't miss these stations. There are few 4 5 procedures, so you can watch videos on different platforms, and then you can start it like two rules, like for 2 minutes a short history, and then go for in history you will have to add the contraindication of the procedure, and indication of procedure, and then go for procedure itself, and then you will have to tell about some uh, side effect of the procedure, or red flag of the procedure to the patient. So you can watch Geeky Medics on YouTube, and Dr. Ankur Gregg is also having some good YouTube videos, so you can follow those YouTube videos, and you can start practice for procedures. So comes to teaching, this is happy station. So this is so lovely station. So if you sometimes they give you two teaching stations in your exams. So and very easy exams. The main purpose of this exam is so the main purpose of the teaching station is that how do you teach to your colleagues, your juniors, and the nurse or student. Okay, so you will have to make sure that it is very happy station. So you will have to introduce yourself in good way, and then um, check the understanding of the student or nurse in very good way. And once you start your station, then you will have to always checking the understand of the junior or the nurse colleague. So these stations are including some examination station. Uh, for example, abdominal examination teaching. Okay, this could become in exam. And apart from this, there are other topics, like for example, you have to teach ECG, urine dipstick, EpiPen, subcutaneous injection, cancer pathway, and consent. So these are very important topics, so you have to do it before coming to the UK, though it is very easy, and you can do easily back at your home. So I would advise you to complete all these stations before coming to the UK to avoid any unnecessary anxiety and uh, issues. So I would suggest that you should at least do uh, the prescription and Simman. It is most important topics. So the first two station, the Simman station and the prescription station, are most important stations. Each and every exam has one prescription or two prescriptions. Sometimes they might be give you sometimes two Simman. So these two stations are very important topics. So you have to do these two stations very well, and then you follow by teaching and examination station and then procedure stations. So if you have any queries or any um, confusion regarding these stations, you can comment below. So I would happy to help out you. So in the later videos, I will try to discuss these topics one by one, and you can follow my YouTube channel for further videos and stuffs like this, so you can get advantage. So thank you so much for staying with me, and see you in another video.